All right, welcome everybody. So thank you very much for joining us today, this afternoon, for this webinar during your lunch break, or carving out, a good 45 minutes to an hour, just to kind of go over this topic, which is a topic that we see a lot, unfortunately, at the clinic. It's essentially, getting out of pain. We want to address what neuropathy is, and we want to see if we can get you some information and some education, so you can make wise decisions on regaining your health and start living your life the way that it was meant to live, enjoying yourself. So a little background about myself is, so my name is Dr. Joaquin Rosado. I'm a co-founder of Regenerative Medicine here in sunny South Florida. And I'm also co-founder of Strategic Health, which is a doctor-curated supplement line. I've been a wellness consultant for over 10 years now. I've been a keynote speaker for Foundation for Wellness Professionals. I have a fellowship in anti-aging and functional and metabolic medicine. I'm a triple board certified physician in anti-aging medicine, in chiropractic medicine, and also in physiotherapy. Throughout this webinar, I'm going to be doing some participation giveaways. So you can submit the answers through the chat box, and after the webinar, we'll go ahead and let you know what you won. So, but I promise it's going to be great. You guys are going to enjoy the webinar. You're going to learn a lot, and just stick around to the end, because, like I said, there are some gifts for people. So first and foremost, what I like to do is just do an agenda for what we're going to be discussing today. And essentially what it is I want to get into the meat and potatoes of what is neuropathy. Most people come into the clinic, and unfortunately, a lot of times they'll come in and they'll say, well, I'm bone on bone, or I have really bad arthritis, or I have neuropathy, and they don't actually know what that even means. They just know they slap a diagnosis on you, and you kind of just accept that and live with it the rest of your life. So I want to talk about that. I want to talk about the different symptoms that are caused by neuropathy. What it's like when it's in a mild form, in a moderate form, and then a more severe form. The different types of neuropathy, because most people, when they say, oh, I have neuropathy, they don't understand that there's many different types of neuropathy. And obviously, what it is to live with neuropathy. A lot of you may or may not be suffering from neuropathy, or you might be attending for a loved one. I want to kind of go into a brief description as to what it is in the life of somebody with neuropathy, and why traditional medications and approaches to treating this haven't worked, right? And the top 5 most common causes of neuropathy. And then I'm going to give you 4 solutions for neuropathy. The 4 solutions, just so you kind of have an idea, involves some sort of cell-based or regenerative procedures. It involves some neurological and or spinal rehab. It involves nutritional counseling and supplementation. So first of all, let's talk a little bit about what is neuropathy, right? So neuropathy is damage to the peripheral nerves. So in our bodies, we have our brain, which turns into the spinal cord. That's known as the central nervous system. So the head and torso is your central nervous system. And then the nerves that go out of the spine and basically feed your arms and your legs, that's called your peripheral nerves. So neuropathy is not something that attacks your central nervous system. It attacks your peripheral nerves, right? So I will kind of go into the phases of neuropathy now, but I do want to just kind of give a quick warning. There's a couple, 2, 3 pretty graphic pictures when it comes to kind of the end results of neuropathy and end results of diabetes, worst case scenarios. So I just want to kind of give you guys a warning, fair warning. It's nothing, obviously, that none of you guys have seen before. However, I just want to give you, because I know, you're on your lunch break. So in case you have a weak stomach, that could be something that obviously that's going to be on these PowerPoints. But first and foremost, let's just talk about nerves, right? So neuropathy affects the nerves. Where do you establish that? So to have proper nerve function, you require, the picture on the left here is a nerve. So you see the red area, that's the capillary, so blood flow to that yellow area. That thick yellow area is like a fatty coating. Think of it like the outer layer of a live cable, right? And then that little almost like pencil thin spot all the way in the tip, that's actually the nerve root right there. So the nerve is encapsulated and surrounded by these fatty layers. That fatty layer helps with allowing for better conduction of signals from your brain to the outer components of your body, right? So when you have mild to moderate degeneration, you can see here, the blood supply, the capillaries, you can see are a little whittled away. That fatty coating, that yellow coating is starting to waste away a little bit. And essentially that change of that outer layer, which helps with the conductivity of electricity, changes the way the nerves are firing. So at that point is where most people start feeling, the traditional, pricking pain and stabbing pain into the feet. Sometimes it can manifest itself in numbness or tingling or burning, cramping of the feet and calves. Obviously a change in the way your body perceives temperatures and a decrease in balance, right? So all of that can be attributed to just mild to moderate degeneration, right? So severe degeneration is where you start wasting away the capillary beds even further. You have less blood supply. So less blood supply equals less nutrients to that fatty coating, that yellow coating. And with less nutrients, that fatty coating, now the nerves are very compromised. So you can see there that even throughout that yellow area, you're not actually getting full coverage of that nerve. So now think of like if you have like a live wire, right? A live active electrical cable, and it falls on the floor, but if there's a piece of that coating missing, obviously there's going to be some shocking there, right? So you have a huge dysfunction there in that particular nerve. So that's where we start seeing those symptoms manifesting when we see the patients at the clinic with things like severe mobility problems. It creates more of a sedentary lifestyle, which in turn creates other problems. But a sedentary lifestyle because you don't feel comfortable walking anymore. You lose your balance, you lose your coordination. So falling becomes more prevalent, right? And then with a lack of blood supply, your body starts to get necrotic. And usually what we'll see, and unfortunately we've seen this time and time again at the clinic when patients come in, and that's why you always have to check the extremities, is since there's a lack of blood supply, there's a lack of healing. Since there's a lack of nerve supply, there's a lack of sensation. So now you could be developing these ulcers in the feet or in the hands that you don't even know are there. You're just walking on them, and that is actually just progressively going to get worse. So I use a word there that's very important to understand. Neuropathy, as a lot of other things in life, it will progressively get worse. It is a degenerative process. Once you start, it is very, very hard, unless you intervene, to slow, stop, or reverse the process. A degenerative process, okay, is a process that will get worse over time, right? So you're worse today than you were 2 months ago. You're worse, you will be worse in 2 months than you are today. So it's a slow progress, right, going in the wrong direction. And then at its final stages of degeneration, where you have no more blood supply and no more nerve conductivity into the extremities, that's where we start seeing things like necrosis of tissue, where amputations become more prevalent. Unfortunately, a lot of people end here when things aren't addressed properly. I myself have had 2 family members that have gone through something like this in the past. I was a child, so these type of therapies that we're going to talk about today should be a light at the end of the tunnel for a lot of you. This webinar is not meant to scare. It's not a scare tactic. It's on the contrary. This is a webinar that's meant to plant a seed of hope that there are things out there that can actually get you better. So the first cause that we see that for neuropathy is diabetes. And most people understand that and they know that, right? So what is diabetes? So obviously when we have too much blood glucose, right? Meaning our body is not producing sufficient insulin to actually eliminate this glucose, put it into the liver where it can be processed, it just floats around in the blood. What happens, and this is a question that I have for you guys, so just write it in the chat box. What happens if I were to take a Coca-Cola, right, and a little bit spills on my counter, right, and I just leave it there for a few hours? What happens to that counter? Write it down in the chat box. Come on, remember, there's participation prizes. It stains, very good, yes. Thank you, Mario, for the participation. Anybody else? So this actually, it corrodes, yes, absolutely. It gets sticky too, right? So when it gets sticky, if you think about that glucose, what it'll actually do to the blood and the blood cells within our body, it'll actually make it so that it's sticky and thicker. So that sticky, thicker blood has to travel through the whole body, right? So usually where we have the thinnest vessels of our cardiovascular vessels in the body are in our fingers, in our brain, and in our feet, right? So if it's hard already for the blood to get down to these layers of the body, when the blood is thick and sticky, very rarely would it get all the way down to the extremities, to the periphery. That's why we start having a loss of blood supply to that particular area. So if you were to do a thermal scan on somebody that has neuropathy, normally this is obviously two legs, right? So the one on the left, you can see that there's a lot of red, there's a lot of heat there, right? Which means that there's a lot of blood supply into those extremities. The leg to the right, you can see there that there's a lot less red, a lot less heat, therefore showing us that there actually is a lot less blood being delivered to that particular part of the body, right? So that's for diabetes. The next cause that we see is spinal injuries. So I've had a lot of people coming in here after, spine surgeries or after falls off of a horse. I've had one. I had numerous coming back from skiing accidents that they've fallen and they've sustained traumatic injury into the spine. Now, if you sustain traumatic injury into the spine, now that's compressing either the spinal cord or the spinal nerve roots that go out into the legs. If there's a compression there, you're compressing blood flow, you're compressing the conduction of nerves. So that obviously can also lead to neuropathy or neuropathic symptoms, right? So here you see a spine. The one on the left is the normal one. The one on the right is herniation. And you can see how that herniation can actually be putting compression on the spine and or nerve roots, which actually lead out into different parts of the body. And you can see here in the dermatome, man, which is just a super cool way of showing where each one of these levels actually goes into the body, right? So it goes external, but also goes internal. So you can see here, you can see my pointer. If you have a herniation on L5, that L5 goes, you can start feeling sensations all the way down to towards the front of the leg, down into the toes. So if you have a compression on that particular nerve, that's the pattern that we can expect for there to be symptoms. Obviously, another reason why you would have spinal injuries as well is just the natural degeneration of the human body, right? So as we age, things start to compress, especially the spine. I remember hearing my grandma all the time say, well, I used to be this tall, now I'm this tall. She's lost 4 inches. And that's just a natural process of the human body. Now, it doesn't mean that we all have to accept that. There's things that you can do to help slow down, stop, or reverse that decompression or that compressive force. However, that is just a natural process that if we don't address, can become a problem. The number 3 cause that we see as a clinic, but also as an industry for neuropathy is vitamin deficiencies, right? So there's lots of different vitamins that can cause, or deficiencies of vitamins that can cause nerve tissue damage. On the chat box, this is number 2, the giveaway number 2. On the chat box, give me one vitamin that you guys know that can cause, if you have a deficiency, nerve damage. My goal is for you guys to know these answers after this webinar, but if you know it beforehand, that's why you're going to get a prize. B vitamins. Chris Drobes, absolutely. Deborah, vitamin D, yes, absolutely, absolutely. So the more popular one is B vitamins, so Chris was spot on, but Deborah as well, vitamin D, you're correct. So I'm taking, my team is taking notes of you guys and who's answering the questions correctly, so I appreciate the feedback and the interaction here. So as you can see, vitamin E, vitamin B1, B6, B12, niacin, which is also a B vitamin, these are all things that a deficiency can cause neuropathy, right? There's lots of different tests that you can do to test all these micronutrients. But unfortunately, as a society, we eat what's called the standard American diet, right? Which is backwards, right? So standard American diet, we actually call it the SAD diet, SAD, standard American diet. And if you're used to years and years eating this way, it's usually a pretty inflammatory diet. So if you have inflammation in the body, which we all do, right? Just living in this society that has polluted air, polluted water, but if you're eating just excess things that are inflammatory without supplementing, right, you're causing inflammation also in your gut. So you could be eating fantastic. You could be eating, all the right things, taking all the vitamins, all the minerals you can. But if your gut is inflamed and it's not absorbing, then you can still have a deficiency. And that's what a lot of people don't understand. I also put a picture here because most people think, oh, it's good for my heart to drink 1 or 2 cocktails a day or 2 glasses of wine. And it is to a certain point. However, with repetition over time, alcohol consumption can actually cause more inflammation in the body, which can actually restrict the vitamins from being absorbed. The neuropathy cause number 4 that we see in the clinic is caused by repetitive stress. So I see this a lot. And sometimes there isn't neuropathy associated with it because neuropathy would be the end result to these types of things. But for instance, constantly being on the computer, constantly being on the computer mouse with poor ergonomics can put compression on the nerves in the hand. And if you put compression in the nerves of the hand, you can actually cause a restriction of information going back and forth. You can also restrict blood flow to the area, which can lead to neuropathy. So I'm not saying not to jump on the computer. I'm not saying to quit your job. I'm simply saying be more mindful of how your ergonomics are, how your posture is while you're working. Take breaks. Take part in making sure that you're not doing anything to cause more issues, being in these situations. And then number 5, which is we see it unfortunately a lot because we're located actually right across the street from Cleveland Clinic. And we see a lot of patients post chemotherapy and radiation therapy. So obviously chemotherapy is being used to, obviously combat cancer, active cancer. Once the chemotherapy treatments are over, a lot of what you're left with is neuropathy into the hands and feet. So we do see that quite a bit. Also any post-infection. So the gentleman on the left, that he's got that rash on the torso, that is actually shingles. So that is a viral infection coming from the nerve that actually stimulates this rash to happen. But what it can do is it can actually cause neuropathic pains in that particular area. So as we already discussed, the 5 most common causes of peripheral neuropathy is number 1, diabetes. Number 2, spinal injuries. Number 3, nerve damage due to repetition, such as carpal tunnel. Number 4, some sort of nutritional imbalance or deficiency, so like a vitamin deficiency. And then number 5, a viral infection and or chemotherapy or radiation. So what I want to do is I kind of want to just walk you through the process and just kind of raise your hand. And I see that a couple of you guys are raising your hands. I promise you, just write the questions and I'll get back to you. I'll answer them towards the end. We can have a one-on-one, or I can email you back any questions that you actually might have. So what I'll do is kind of walk you through this process, and then you tell me by raising your hand if you've actually gone through this before. So you start having symptoms, maybe a little clumsiness in the hands and feet. You go to the doctor's office. Doctor, prescribes possibly, sits down, talks to you for 2 to 3 minutes, and then prescribes, either refers you out to a neurologist and or will prescribe a certain test for you. So either a nerve conduction test or some sort of like a nerve punch biopsy of the particular nerve to see how the nerve's health is, right? Then the end result is pretty much, from what I've heard, always the same. It's either pain medications for the pain, nerve medications like gabapentin, and or anti-inflammatories such as naproxen. So raise your hands. Has anybody gone through this? I got a couple of hands raising. Very good, very good. So unfortunately, that is the traditional way of treating this, right? So neuropathy, till just recently, I would say was treated this way solely, right? There's been a lot of advances in how we can actually treat neuropathy. But as you can see with this, pain medication, all it's going to do is reduce pain, right? Nerve medication, all it's going to do is stop the nerves from hurting or firing, right? And then anti-inflammatories are going to reduce the inflammation in the body, right? Is there anywhere here that would actually fix and or stop and or reverse the process of neuropathy? I don't see one, right? This is just simply managing the problem. It's managing the symptoms, better said. It's not even addressing the problem. It's managing symptoms. So I want to talk a little bit about probably the number one medication that most people receive from their doctors for neuropathy, and that's gabapentin or Neurontin, whether you're taking the brand name or off label. So FDA has approved gabapentin. It is an FDA approved medication, but not for neuropathy. The FDA has approved gabapentin to treat seizures and epilepsy. So gabapentin, what it does is it suppresses the activity or the firing of the nerves in the brain, right? So it's depressing the nerve function within the actual brain, right? That's basically the mechanics of it, right? The mechanism of it. So you can see, if you were to look up side effects for gabapentin, it's dizziness, fatigue, double vision, memory fog, memory loss, drowsiness, difficulty speaking. Why? Because we're depressing the activity in the brain, right? So raise your hands to see how this is probably not the best way to treat pains in your hands, right? Nowhere is it said that it actually treats the hands directly, right? Because it doesn't, or feet for that matter. So one thing that I also wanted to bring up about gabapentin is, if you were to look up in the FDA's website about all the warnings on gabapentin, there is actually a black box warning for gabapentin and Lyrica, which are both very widely prescribed for neuropathy, okay? Now, black box warning is the highest warning that the FDA issues, right? And there's a black box warning saying that if you take gabapentin or Lyrica, that you're at risk of serious breathing problems with seizure and different pain medications, such as Neurontin, Lyrica, Horizon, all of these different medications. So again, raise your hand if you feel like you deserve better than that. I believe you do. I believe I do if I had neuropathy. This is something else that I actually looked up. And what I did is, when I do these webinars, and we treat a lot of things at the clinic, neuropathy is a huge component of it. But one thing that I've actually, I always do a lot of research on it. So as you're typing in gabapentin linked to, a lot of different searches pop up on Google, right? So as you can see here, there's a growing number of links to gabapentin to suicide attempts, which is devastating, right? Obviously, people are going through pain, they're taking the gabapentin, right? However, if you have a depression in the way the brain works, let me ask you something. Where is it that we have serotonin and all those feel-good hormones in the body? Write it in the chat box. Chat box. Where is it that we release the feel-good hormones? It's in the brain. Very good. Very good. Aleli de la Vega. Very good. We got a lot of smart people in this room. So when you depress the activity in the brain, you're depressing all the activity in the brain. Does that make sense? So one thing that I wanted to actually pop up, and just give me 1 second, because actually this is very important to look at. So if you were to look at this one here, right? Can you guys see? Just right there in the chat box, can you see the new page that I'm sharing? Okay, so this one here, gabapentin, if you were to scroll down, this is on the Mayo Clinic's website, okay? So if you were to look at gabapentin, right, and you go down, these are all the interactions with all these medications. Most people that are on medication for diabetes and or pain and or neuropathy are taking some more medications. Check this list out. I'm not making this up. This is literally, go to Mayo Clinic, right? Now, if we go to the precautions here, right, you can see here, this medicine may cause serious allergic reactions, anaphylaxis, angioedema. Gabapentin may cause vision changes, clumsiness, unsteadiness. The medication can make you agitated, irritable. This is not okay for me. This is not okay. And look at these very common side effects: clumsiness, unsteadiness, right? Rolling of eye movements, uncontrollable, aggressive behavior, anxiety, crying, depression. These are all things that, again, are just not okay with me, right? So let's go back to the, okay. So I just wanted to kind of show that, because this is just something that, it's not me telling you. I do a ton of research. My job as a doctor is to do the research so that I can present for you the information. You do with it what you will. However, I want to give you the ammunition to make educated decisions, right? Which I think a lot of doctors are intimidated by that. When a patient questions the doctor, we at the clinic embrace it. We're a team of 5 different physicians and another team of 10 other practitioners, and our goal is to be questioned and tested so that we can educate the people that come in through our doors, right? So today, like I said, it's not all about the doom and gloom. This is, I want you guys to see that what can happen if we just do nothing about it, right? But if we have solutions for it, then I want to present those to you guys as well. All right. So the number one solution would be using something like a cell-based medication, right? We actually specialize in this. I have a fellowship in anti-aging and regenerative medicine. And what that means is we can put together programs to actually help your body heal itself, right? Without the use of these medications, all these different side effects, right? And contraindications. So we can start regenerating that tissue. So in order to talk about regeneration, you need to understand what is the opposite, which is degeneration. We touched upon it earlier this webinar. Degeneration means it's going to be worse over time, right? So again, think about when you first started having these sensations. When is it that you first started feeling this way, right? Now think about how you feel now. That might have been 5, 10, 15, 20 years ago, right? So whatever that time frame was, if you do nothing about it, how are you going to feel in 5, 10, 15, 20 years? What is it that you've lost? What is it you've lost out on doing because of this disease, right? Which is something that is not just controllable, but most people get relief. It might not necessarily go all the way away, but getting relief to the point where you can actually restore some normal and enjoyable quality of life, right? And that's our goal. So there's different therapies that a lot of different clinics use. I'll talk to you guys a little bit about what's out on the market, and I'll kind of tell you guys what we usually recommend at the clinic. So obviously using some sort of cryopreserved umbilical cord stem cells is an option in a lot of clinics. Using amniotic tissue, using exosomes, which is a very regenerative product, but it's not an actual stem cell. It's just components of it, which help regenerate tissue. And then using things like PRP or platelet-rich plasma, which have growth factors which stimulate new blood flow to the particular areas, right? So first I want to talk about the one that we do mainly for lots of different things. But neuropathy, I've seen some pretty good results with it. And it's PRP, also called platelet-rich plasma. And what that does, it actually, we can isolate components of the blood. So we were to draw a tube of blood, or 2 or 3, and we spin it in a centrifuge. Then what comes out is this tube right here. It's basically separated into the top part, which is the plasma, which is where we have tons of different proteins and cytokines and things that help heal tissue. Then that layer on the bottom is called erythrocytes, which are actually your red blood cells. So the blood cells which carry oxygen and iron. And then that middle part is called the buffy coat, and that's where the majority of the platelets is, right? So for a lot of these procedures, what are used is the yellow component and definitely the white component, right? So that's where you would find the most regenerative, most healing properties in the blood. The good thing with this is, since we're using your blood, you don't have to blood type, you don't have to match. These are procedures that literally are done in-house, whether it's here or elsewhere, and it's following the tracks of the actual nerve damage. So it's your blood, right? Now, I'm gonna go over some pictures of a patient that had come in. He had had neuropathy for, I think it was like 15 plus years. I can't remember exactly what it is. His name's Isaac. He came in and he had been dealing with an open ulcer for about 3 years, right? Just making sure it stayed clean and all that. And the reason why he had this ulcer was because he couldn't feel that it happened. And it was getting infected and infected and infected. And there was no blood flow to the area to heal the tissue, right? So what happens is he went in, and this was a while ago, like 3 or 4 years, remember, to do a punch biopsy of the actual nerve. So he actually went to a doctor's office just to test the nerve, right? And this is actually what happened, right? So he was dealing with this for about 2 to 3 years. I put 3 here, but I think it was about just under 3 years. And he had really bad neuropathy, no blood flow, no nerve, very little nerve conduction to the area. That site right there that you guys are seeing is actually where the punch biopsy was done, where they went in to basically take a piece of that nerve out to check it, actually got infected, never healed, and he was dealing with this. So what we did is we didn't just only treat him for neuropathy, we also treated this actual open ulcer. And it was treated with PRP. So you can see 2 weeks after the first injection, how the skin color and inflammation has significantly improved, right? So it started to kind of grow some new skin on there. The infection seems to have gone away. The tissue's healing, right? 4 weeks after the second injection, you can see how this is pretty much closed altogether. Remember, he was dealing with this for 3 years, right? So this is actually healed over significantly, right? And again, this is external. So we're doing these procedures in Isaac's case externally, but we're also doing it internally also. And we were getting some new blood flow to the nerves to stimulate more nerve growth. Now, I want you to remember, nerves are regenerative. There's neuroregeneration. If we damage nerves, they can grow back. If we damage nerves, they can heal. So all we're doing here is we're not replacing the nerve. We're giving your body the ability to actually help regrow, reheal that particular tissue so it starts functioning optimally. So solution number 2 for neuropathy, which is one thing that we love for everything, is ozone therapy. Now, the importance of ozone therapy is that it delivers super high concentrations of oxygen to these blood-deprived tissues. So we already talked about the fact that towards the end of the body, there's no blood flow. And as we discussed on a couple of slides ago, when you separate the blood, you have the yellow component, which is the plasma, but on the red blood cell area, that's what actually carries oxygen in our body, everywhere, not just to our feet, everywhere. So without those red blood cells circulating around the body, there's no oxygen, right? So you can see the importance of if we're injecting or doing any therapies with PRP, but then it would be very important to actually deliver oxygen to that area because it's going to cause much faster tissue growth, much faster tissue healing, much faster wound healing, and an anti-inflammatory action or response, right? And ozone has been around for 50, 60 years being used regularly, right? The next solution, and we kind of briefly touched upon it earlier, is spinal rehab, right? So as we age, like we talked about, the disc height shrinks, right? As the disc height shrinks, those discs have a jelly material in the middle. So that jelly material has to go somewhere, right? Usually it'll start poking out towards the side, creating a bubble, which is known as a disc bulge. Or if that bubble breaks and the disc material goes out, that's considered a disc herniation, right? If those disc bulges or disc herniations are putting compression on these nerves or compression on the spinal cord, you're gonna have neuropathic pains and symptoms down the leg. Think of a nerve like a USB cord. There's fibers that take information out. There's fibers that bring information back. depending on where you're compressing those fibers, that's what you're going to be impacting. If you're compressing the pain fibers, then you're either going to feel pain or you're going to feel nothing. If you're compressing the activity or the action fibers, then you're going to have drop foot, or you're not going to be able to contract your leg, right? So it all depends on where it is. So that's why it's very, very important to do a very, very in-depth evaluation to see where it's coming from, not just 2 to 3 minutes, quick consultation, and then willy-nilly, here, take some pain medications and gabapentin, right? This is something that is a lot more involved than just, here, take this, right? The next and final one that we'll talk about, the solutions, is nutrition, right? I know most people hate to talk about this because I love food just like you guys do, right? And usually it's not good food, right? That tastes good. But the idea of starting to change your lifestyle because you're doing it medicinally, right? You're not just eating food to eat food. You're eating food because food is medicine, right? So if you're eating the proper foods, you're feeding your body the right fuel. If you're eating the wrong foods, then you're feeding your body the wrong fuel, right? So there's lots of different lab tests that we can get and dive super deep into nutrition. But we do, for instance, micronutrient testing, which tests all the vitamins in our body, all the minerals, all the antioxidants. We do stool testing to see what the gut bacteria looks like, right? We have overgrowth of one and not the other. So we can address that accordingly. But the best way that we've seen to automatically bypass all of that is just doing IV nutrition. So we already know that the B vitamins, there's different vitamins that if we don't have them in our body, our nerves are not going to heal. If we're trying to heal nerves, then we need to make sure that all the micronutrients, all the nutrition that our body needs to heal is in our bloodstream, right? And the best way to do it is things like this. So here, like I said, IVs delivers 100% bioavailability. You basically, instead of having to take a pill and hoping that your body absorbs 20, 30% of it, this goes 100% of the vitamins right into your bloodstream, right into all the nutrients. So right now I want to talk about the 2 most commonly asked questions that I get as a practitioner. So how do I know this is going to work for me is question number 1, right? And then number 2 is this covered by insurance? So how do I know this is going to work for me is simple. Gabapentin, we already know does not work. Hydrocodone, we already know works great for removing pain, but is not fixing the problem. There's no way that any doctor would ever say that they're 100% positive that this is going to work for you. However, clinically, not just in my clinic, but in my colleagues throughout the country, we do get pretty good success rates doing different protocols, right? So that's if it will work for you. And then if it's covered by insurance, or how much is it going to cost me? The answer to that is unfortunately, standard insurance models don't cover these types of procedures, right? They'll cover you to go into a doctor and get a diagnosis. They'll cover your prescription medications. They'll cover the surgery when the prescription medications don't do anything for you. But unfortunately, things like this, as of right now, are not being covered by insurances. However, as a clinic, we make it so that our number 1 policy is to make sure that whatever it is that we can do to make it accessible and affordable for our patients that want to get better, we will work with you 100%. I'm part of a nonprofit organization, and it's my duty and obligation to make sure that I do whatever I can do to make it work for you. So, I guess, at BioCure, we believe that you deserve better. I believe you deserve better. The idea here comes now, do you believe you deserve better, right? So just like anything in life, at all, ever, when making a decision, whether it's buying a car or healthcare, you have 3 options. You could just stay there and do nothing, right? And kind of like an ostrich, put your head in the sand and hope nothing happens, and don't watch this progressively get worse. You can do number 2, which is continue doing exactly what you're doing now. If you're on this webinar and you are suffering from neuropathy, or a loved one is suffering from neuropathy, you're probably already doing something, and it's probably not working at its best, giving you the results you're looking for, or you're just looking for something new that's actually going to help treat the underlying cause, as opposed to just putting band-aids on the symptoms. Or number three, you can try to do something different, right? So if you continue to do the same thing, you're gonna get the same result. So that's actually verbatim the definition of insanity, right? So what I wanna do is, for you guys that have stayed with me throughout the whole process, I think I lost one of you, which is actually fantastic. We had 31, we got 30 participants. I wanna give you guys a webinar special. So the webinar special consists of the following. You're gonna receive a consultation, and I wanna kind of paint this picture for you. You're gonna talk to, the team here is very compassionate, very empathetic. They will listen to everything you have to say. They're gonna make this the easiest process for you to get the care you need. You're gonna come in, you're gonna do a full exam with one of the practitioners. We will do any x-rays required, as already talked about. Sometimes if it's neuropathy in the hands, it can be coming from the neck. Sometimes if it's neuropathy in the feet, it can be coming from the low back. This takes about 2 hours. I'm also gonna throw in one of our proprietary blends it's called Restore Plus, and it's something that myself and my co-founder, Dr. Vanessa Chappell, we put together along with world-renowned pharmacists from different pharmacies within the United States to put this formula together, and it works very well for reducing inflammation. You're also going to get one of these bottles, and this is the bottle here. It's just called BioPure Nutraceuticals Restore Plus. And the webinar special, what I want to offer you as a gift, again, for sticking with me to the end, is you'll get the consultation, you'll get the neuropathy evaluation, which is normally $250. You'll get any x-rays that are required. Normally it's about $150. And then the BioPure Nutraceuticals, which is $85 per bottle. And you would have, it's a $485 value. It's only $47. And honestly, truly, I used to do these consultations for free, right? I used to not charge anything for the consultation. This $47 is truly just a reservation, just to reserve the spot. And the reason why I do that is the following. There's a lot of people on this call or on this webinar that truly want to get better. So if I get somebody, a whole day's worth of people that are on schedule, right? And then none of them show up, they took the spot that could have been yours. You're trying to get better, and that spot was taken by somebody that had no real reason to come in, right? They just got excited during the webinar and scheduled the appointment. So that $47 is just simply a reservation fee. So in order to get that, there's 3 rules that you need to follow, all right? Number 1, I ask for you to please come with to the initial evaluation with your co-decision maker, be it a spouse, kids, significant other, somebody that has seen you degressing, right? I want to have this consultation with you to hear it from you, but I also want to have this consultation with somebody that has seen this happening to you. You see things one way, they see it another way. I want to find out what is truly going on, how bad this has gotten for you, right? That's why I ask for you to bring somebody with you. Number 2, the appointment has to be made within 1 hour after this webinar is over. We are an extremely busy clinic to the point where there's some weeks that we don't even have availability to come in. What I did is I actually had my team open up 1 extra block of time to be able to see another handful of you. So on the bottom, it says there's 5 appointments available. There's actually about 10 to 15 appointments available. But again, the appointment has to be done within the first hour after this webinar is over. And then number 3, when they reach out to you to go ahead and reserve the confirmation, we just ask that you place the $47 reservation fee down, right? Like I said, that is simply to reserve your spot on schedule. That's it. So I'm giving you the gift. Now here's the reason why you should accept it, right? So like I said, I'm offering it to you. You don't have to accept it, but this is the reasons why. If you don't try something else, nothing is going to change. You're going to be in the same boat as you were a month ago, today, possibly getting worse, right? As time goes on, because neuropathy is degenerative, meaning it gets worse over time. There is one thing that is certain about degenerative conditions. They do not stay the same. They either get better or they get worse. So the best time to get better was yesterday, But the second best time to get better is today, is now. So make your appointment. I'm very much looking forward to meeting you guys. I want to be able to, and my team, give you back happiness, give you back your quality of life. You truly have nothing to lose. A little bit of time. That's it. So I want to thank you very much for attending. On the screen here, there's an email address. That's info@getbiocure.com. Once again, info, info @getbiocure.com. You can email us any questions or concerns. You can call us at 754-206-0838 or text us. If you put your name and phone number on the chat box, my team will call you. So if you put your name and phone number on the chat box, my team will call you within the hour to go ahead and let you know when we have the availabilities and see when we can start taking good care of you. Okay? So I really, really hope you guys take advantage of this. I really, really look forward to meeting you guys. It's been great to be able to present this to you. So I'm going to go ahead and get going because I've actually got to get started at the clinic in about 10 minutes. But my team will stay on and they will be looking at the chat. Anything that you guys, any questions you have, you guys want to make the appointment, please put your information there and they'll reach out to you. Have a nice rest of the day. I look forward to meeting you.